20 years old to 65 years old. So they're in the most productive time of their lives, unfortunately. We then looked at the disease duration, and because ME/CFS is a long-term chronic disease, so I guess it's as expected, a lot of patients, unfortunately, have already had more than 20 years of diagnosis of ME/CFS, and the bottom is long COVID, and as expected, the maximum would be somewhere around 3 years since 2020. So one thing that we noticed is that among the responders, most of them seem to start responding, when they're at least 6 months after they had the disease. So in other words, their symptoms didn't really resolve after at least 6 months, as you can see here in long COVID. So in a sense, their symptoms are persistent. So this is a comparison of the symptoms. So we basically ask them, what are the most bothering symptoms? Your left side in blue are ME/CFS patients. Your right side in red are the long COVID patients. So as you can see here, the top bothering symptoms are fatigue, PM, brain fog, refreshing sleep, memory problems. So these are, in essence, the symptoms that we know very, very well in the ME/CFS community. And perhaps the only sort of slight difference would be, you would potentially see there's little bit more shortness of breath on the long COVID side, and there's more chest pain on the long COVID side, which